I'm Jeff Popp, cosmetic surgeon, been in practice in Omaha for over 30 years. We have a broad range of things we do, cosmetic surgery pretty much from head to toe. Today we're going to talk about lips, I believe, and lips have become very popular in recent years. We do literally probably hundreds or thousands of cases each year, if you include the three things that encompass lip rejuvenation. One would be filler, which we do a lot of. We probably do 2 or 3, 4 a week. Lip lifts, and then lip implants. I would say that anybody who's thinking about having something done to their lips, stay away from the Real Housewives and some of those other people who have huge lips. They don't look good. And the problem that most of us see is that, and I show this to people, is people who have ugly duck fat lips, when they look at themselves, they see themselves straight on, which is a whole different view than if you look at that person from the side and they look like Donald Duck. So they don't sometimes see how ridiculous they look, because the selfie they're going to take, or getting dressed, getting made up in the mirror, they see this view. They don't see this view. So don't go there. It just looks ridiculous. A little goes a long way, and that's maybe the bottom line with lips. Don't overdo it. So lip fillers, first of all, are the most common lip procedures worldwide right now. And again, mostly because of the ease to do it. You can come in, have it done, and go back to work. Now, granted, there are some side effects like swelling and bruising, but those are typically minimal. The downtime's very little. Obviously, it's not surgical. So the procedure itself, in terms of timing, probably takes 20 to 30 minutes. Part of that depends on whether you're just doing the upper lip, the lower lip, or both. Not everybody needs both upper and lower lips done. Some prefer just the upper. That's more common. And it's put in incrementally and slowly through a cannula, injected in the lip. So you're probably looking about 20, 30, maybe 40 minutes at the most. I think our office is representative of most places that do lip fillers, in so much as I don't actually do those anymore. I used to. When fillers first came out, I think every physician did it. Gradually over time, the filler process has been delegated to nurse practitioners, physician's assistants, and the like. In our office, we have one of our RNs, Amanda, is a rock star with lip fillers. Truly has become the best lip filler. She does all our lips. She does my wife's lips, my daughter's lips. She does everybody's lips. And it's interesting because the evolution of this for her all comes from both her and my absolute hatred of the duck lip, of having big, fat, juicy lips that look like duck lips from the side. And so she's evolved and become the lip injector expert. She understands that duck lips are forbidden. They will not be allowed. I do not want my name attached to that. Those are the ugliest things on the planet. And how that evolved as something that's considered aesthetically pleasing, I'll never know. So she's really good at subtly enhancing lips without making them look weird. So first, there's the recovery aspect to the filler. Absolutely everybody has swelling. Some people have bruising. That varies. That swelling and bruising usually lasts a few days at the most. We usually have them ice their lips the day of the procedure. That helps. And then once we've established a result that's satisfactory to patient and practitioner, we would expect the filler to last anywhere from probably 6 months to a year. The interesting thing about filler is the duration of effect of filler is dictated in part by the muscle activity where you inject it. If you inject filler, say, in the cheeks, there's really not much movement there, and that will last sometimes several years. Lips, on the other hand, we're constantly talking, we're eating, we're chewing, those sorts of things. So the dynamics and the muscle activity tend to cause it to go away a little bit quicker there. There are different types of fillers for the lips. I would say that the one that is used the most is a substance referred to as hyaluronic acid. Brand names would be Restylane, Juvederm. They have specific types of hyaluronic acid filler that they think are best for lips. For example, the Restylane people, their hyaluronic acid for the lips is called Kiss. Clever. So that hyaluronic acid is probably the number one filler that's used in lips. First of all, it probably works the best, but there's a catch with some of the fillers. Hyaluronic acid is reversible. And in fact, it's probably the filler we use 99% of the time, in part for that reason, because it implies a safety aspect that more permanent fillers don't have. People do have complications from everything we do. Fillers no exception. So if a person gets, maybe they don't like their lips, maybe they're lumpy or something. The great thing about the hyaluronic acid fillers is you can inject an enzyme into that filler and it will literally melt away overnight. So it's completely reversible. And that's a safety component that's worth hanging your hat on. There's just nothing better than being able to reverse something you've done. So we're talking now about lip implants, and there's only one company that makes lip implants. They're called Permalip, and they're actually very soft, solid silicone rubber strips. Almost looks like a very fat toothpick, if you will. And they're very rubbery, and they come in different diameters and slightly different lengths. The idea behind a lip implant is you're basically adding volume to the lip, but in a permanent way. Unlike fillers that eventually will go away, a lip implant will stay forever. So this is an option for people. Let's say someone is happy with fillers, but they wish it lasted longer or desire it to last longer, they could then move up to the Permalip. So lip implants, Permalips, these little solid strips of silicone, it is a surgical procedure, but it's not a big deal. We have to numb the lip up, and then we make 2 access incisions, little puncture sites at the corner of the mouth. These are called the commissures. You're talking maybe 1/4 of an inch, maybe 1/8 of an inch. We then create a tunnel across from each incision, and we actually pass a little curved device that goes through that tunnel. It grabs the implant and pulls it back through, and then we put 2 little dissolving stitches on each side. So it is surgery. Therefore, you're going to have bruising and swelling as a recovery. And with most surgeries, you have to speak about the scar. These little incisions are so small that scarring is really not an issue. But people sometimes can have a lot of swelling and a lot of bruising, and that just has to go away over the weeks. The full recovery, you're probably looking at 2 to 4 weeks. One of the things that people ask about lip implants is, can you feel them? In certain lips, especially thinner lips, you can if you really smash the lips hard and kind of manipulate it. But for the most part, you can't feel them, you can't see them. They don't, in most instances, alter your smile or that sort of thing. We actually, in the recovery process, once people are about 3 weeks out, we actually have them start massaging their lips, actually have them start stretching them and doing whistles and opening their mouth wide to sort of create a softer environment for that implant to live in. One of the risks of fillers and with any surgery is scar tissue, and if a person develops excessive scar tissue around that implant, then it can distort the lip. One of the wonderful things about implants, particularly lip implants, is it's reversible. If you don't like it, if you have a problem, it's easy to take out. Lip implants can be upper lip only, lower lip only, or both. I'd say in most situations, people do both. A person who would be a candidate for a lip lift, first of all, it might be an older individual, because as we age, the lip lengthens. This part from the base of your nose to the pink part of your lip is called the philtrum. And we basically say that 20 millimeters from the bottom of the nose to the edge of the vermilion border, which is, the vermilion is the pink part of the lip, and the border is thus called the vermilion border. 20 millimeters or greater is considered too long. So if you have someone who really has very thin lips, and that's probably the key issue with lip lifts, you just don't really see. They put lipstick on and you just have thin lips. So the idea is to lift the lip up so that you show more of the pink part of the lip, the vermilion. You can't create that type of lip with a filler. You can add all sorts of filler and make it thick, but that's not going to lift the lip up and show more of the vermilion. An older person is more likely to need a lip lift than a younger person. That doesn't mean younger people can't have lip lifts. Genetically, some people have very long philtrums. They have thin lips, so it's not necessarily strictly age-driven. So this is surgery, and this is probably, of the three lip options, filler, implant, and lip lifts, is the most aggressive, because it requires an incision and scar that follows the bottom part of the nose from the edge of the nostril all the way across. So there is a scar there, but because it's at a junction of two anatomical parts, the nose, the base of the nose, and the philtrum, it's a scar that can be disguised. We do that all the time with surgery, where we put incisions in natural creases or folds or junctions of two anatomical parts to help hide the scar. But nonetheless, there's a scar there. And scars of any type take months and years to become, to look their best. In other words, to mature. It's easy to say that regardless of the scar a human being may have, it could take up to a year or more for that scar to look its best. So you've got that, and that's the longest recovery. Now, the upside of that is after about 3 weeks, you can start wearing makeup to hide the scar. So the recovery of a lip lift is three things: scar, bruising, swelling. And actually, that's probably true of almost every surgery. Those are the three things that dictate recovery. And the bruising and swelling is in part individual. Some people don't swell much or bruise much, but as a rule, we say that bruising takes about 2 or 3 weeks to go away. Swelling could last for 6 to 8 weeks. And then, of course, the scar for months and months. Now, you can do lip lifts, and you can also add filler to them. Once you get that lip showing more, you still may need some volume. Now, there's different types of lip lifts as well. The traditional one is the one that follows the bottom of the nose. That will lift the central, let's say 4/5 of the lip, but it doesn't pull the outer part. So some people, when you lift the central part, there'll be a little droopy here on the outer part, and you can do what's called a lateral lip lift, which is right at the edge of the lip here to give that lift too. So there are two approaches to any cosmetic consultation. There's listening to what the patient desires, and there's the doctor telling the patient what they need. I tend to be the patient desire guy, which is in the minority. Most of the time, if a patient comes in to see a physician for a procedure like lips, we tell them what they need. You need this, you need that, this is what I'm going to do for you. Personally, I think that's wrong. I think that the statement that beauty is in the eye of the beholder will never change. And the only person who matters is the patient. Not me, not their family member, not their neighbor, sister, brother, whatever. So I always say, what is it? I usually give a patient a mirror. And I said, okay, show me what it is you want to change, enhance, you don't like. And then I can help them from there. So that's how our consultations work. They're more patient-driven than me-driven. In fact, I'll even have patients say, well, what do you think I should do? And if they put that question to me, I will universally tell them nothing. Because, again, I don't see this as being something that is my standard for beauty. I certainly have beauty expertise, but everybody's different. So the consultation really starts there, and then again, we move forward with some of the things we've already talked about as far as the thinness of the lip, the bulk, that philtrum length, how much of their teeth show when they smile, that sort of thing. When you speak of cosmetic procedures in general, I think the person probably needs to be of legal age so that they can sign their own consent. I would probably draw the line there. You have to be able to sign a consent, not have a parent or a guardian sign your consent. None of these procedures are covered by insurance. They're all considered cosmetic. So the cost of these different procedures is as follows. Filler, you're usually paying for a syringe, the cost of the actual material, the filler itself, as well as the cost of injecting it, whether that's me or one of my nurses. So a syringe, and of course some people may need more than one syringe, but a single syringe injected by us runs around $700 for the hyaluronic acid filler. The lip lifts, the lip implants, which includes the implant itself, the surgery, my fee, anesthesia, operating room charge, I believe runs around $2,100 to $2,800. And a lip lift is going to be a little bit more than that, probably in the upper 2,000 to upper 3,000 range. None of the surgeries require a big surgical setting, but they are surgical in the sense that they have to be in a sterile environment. We have a state licensed, nationally accredited surgical center here, so all the surgeries are done here. So if we talk about lip procedures and look at contraindications, somebody who may not be a good candidate, it's not an absolute contraindication, but there are some people who have recurrent cold sores. The procedures, whether it's a filler, lip lift, or implant, can exacerbate that, cause cold sores to come out. We do have drugs that treat that and suppress it, so we don't really consider that an absolute contraindication. In the filler department, some people feel that if you have certain autoimmune diseases, that might be a contraindication. You are injecting a foreign substance, so your body's immune system might react to it differently. A lip lift, which is really just, there's no foreign material left behind. It's basically all the patient's natural tissue when you're done. The only contraindications there would probably just be general surgical things. If you were sick, if you had for example, some reason you couldn't go off a blood thinner or something like that. It gets a little more complicated, but there are some contraindications, but they're very few for any of them. Let's talk about the pain with each one. All of them have pain. I would say that it's not horrible pain, and it's usually brief at the most. If we start with filler, we are injecting something in the body, so there's a needle stick. We do apply a topical numbing cream, and actually we use these certain devices that cool the tissue, make it cold, which helps with the pain. All fillers currently have a local anesthetic in them, lidocaine. So what happens with filler is as you inject it more, because you don't just inject once, you have to inject little amounts to sort of, there's a certain artistic element to fillers because you want to make the lip look normal. So you inject a little here, a little there. But as you go along, the lip actually becomes numb because the lidocaine takes over. So with filler, there's some maybe burning and stinging initially, but then that's gone. Now, when the local anesthetic wears off, there's no pain. With the lip implant, obviously we have to numb you up. But then in the aftermath, there really isn't any pain. And I would say that would be true of the lip lift as well. some soreness around the surgical site, but really not much at all.